yes, I'm just, thank you. Thank you very much. And thank you for the opportunity to present.
Welcome.
I'm
Thank
just
you.
going to share my screen. Can you all see my screen?
Yes.
Great. So as Christoph mentioned, my name is Taralee Reddy. I am a statistician at the Biostatistics Unit of the South African Medical Research Council. Since our first COVID-19 case on the 5th of March, in the SAMRC and specifically the Biostatistics Unit as well, has been very involved in providing support to COVID research in the country. So right now we're providing support to government, so specifically the National Department of Health. So we're assisting with looking at analysis of the contact tracing efforts, mortality to try and assess what are the key predictors of death and what specific comorbidities are the main risk factors. As well as looking at an overview and the effects of various interventions that were put into place. The work I wish to share today is work that we've done as part of a modeling group that we joined, and I've just mentioned a few of my colleagues that were involved in this work. Charles Janse van Rensburg from the SAMRC, Professor Ziv Shikedi from Hasselt University, and Professor Samuel Manda, who you've just met, who's also the director of our biostatistics unit. And this work is on behalf of our larger COVID-19 modeling group, which includes various colleagues from different institutions. The title of my presentation is Real-Time Prediction of COVID-19 Cases and Deaths in South Africa. So just to give you a little bit of an insight into what is happening in South Africa right now. So as of 2 days ago, the 6th of July, we had just over 200,000 cases in the country. And by cases, we mean laboratory confirmed COVID-19 cases, and we had over 3,000 deaths. But this corresponds to a current mortality, a case fatality rate, of under 2% in the country. This is a graph that I like to show because it's showing two things. It's showing the rate of new tests. So we have the tests performed per day, which is your orange curve, and the blue curve is the number of newly diagnosed cases per day. And what you see, which is totally unsurprising, is the more tests we do, the more cases we detect. So it's quite crucial that any kind of modeling we do, which is based on cases, is a reflection of the number of tests that we do. There are several modeling approaches for epidemics. Some that have been most frequently used in South Africa to date are those of the mechanistic type. So one example is the SEIR model. So this is basically where you split up the population into compartments, and you make a few assumptions about how people may travel between these compartments. So this makes several assumptions about the transmission dynamics of a disease. Another approach is that of phenomenological models, and one of these is generalized growth models. So basically here you make no assumptions at all about the system or how people move between stages. You're basically modeling the data at hand via curve fitting. And this is the approach that we take. So we were very interested in looking at whether we could actually predict what the future has in store for South Africa in the short term. So I'm going to start talking about the short term. So if you look at the curve on the left, you'll see the little circles represent observed cases to a particular point, and this is including data up to the 6th of July. And the line that extends tells us where we think we're going to be in the next month. So according to our forecasts and using these models that I've just mentioned, by like in a month from now, on the 6th of August, if we continue at the growth rate we're going, we're expected to be sitting at 730,422 cases. You can see that as we try to predict a bit further on, our prediction interval gets a little wider. So if we were just looking at predicting for the next day, for example, which is the first row of that table, the 7th of July, you'll see that we can predict that value with a high degree of precision. So we had predicted that we'd be sitting on 214,824 cases. And you can just see a few other crucial forecasts. So you could see that 5 days from now, so if we look at, say, the 12th of July, we would be expected to have more than 70,000 additional cases. This is quite crucial, particularly for the optimal allocation of resources. As many of you know, we have quite a constrained health system. We bear quite a large burden of HIV and TB, and it's quite crucial that when we do reach our COVID-19 peak, that we can optimally allocate resources in the country and plan effectively. So the biggest question is, it's fine that we can do these predictions, but do they actually work? And can they really be used to guide us? So how accurate are they? So repeating this exercise, looking at data from more than 2 weeks ago, from the 22nd of June. So if we use data up to the 22nd of June and we tried to predict where we'd be, there were several models fitted, and the model that provided the best fit at that time is denoted by the red dots, and it overlaps with the green dashed curve, as you can see. So we had predicted, using data up to 2 weeks ago, we had predicted that on the 26th of June, we'd be sitting at 128,257 cases. This is based on the best fitting model, which is a 3-parameter logistic. And we actually were sitting at 124,590, so slightly below. If we look at predicting 5 days after that, on the 1st of July, we had predicted from our model that we would be at 158,859 cases, and the actual cases we observed was 159,333. So it is relatively close, and it's relative. So the little stars that you see on the graph, the red stars, represent the actual observed values, and you can see that they quite close to the curve fitted. The important thing to note is that these curves are refitted daily. So, and that's really the strength of real-time prediction, is as new information becomes available, your prediction gets revised. So particularly in this time where we're experiencing rapid growth, you'll see that we had predicted from our model that on the 6th of July, we'd predicted that we'd only be sitting at 193 cases, 193,000 cases, but we actually were at 205,721, which really illustrates the importance of calibrating this model daily so that you can get updated forecasts. But overall, we feel that it's relatively close and it provides a relatively accurate prediction in the short term. This process can also be done for deaths. So a similar growth curve fitting approach. And deaths can be argued that it may be a more accurate reflection of what's truly going on, given the strong relationship I mentioned between cases and testing. So if we look at our forecasts for deaths, we predict that a month from now, so this is using the data up to the 6th of July. So on the 5th of August, we predict that we'd be having 4,740 deaths. And you can see that as we predict further on, this prediction interval does get wider. So the big question that's on everybody's minds is, when are things going to start getting better? And when can we expect this to end? We have produced a long-term forecast that we could look at. But the important thing to emphasize is that this is a situation that's changing daily and it's so dynamic. But based on the data up to the 6th of July, and looking at the long-term forecasts, the curve on the left shows you the cumulative cases, so the total cases that we would have. And you can see that as we look at forecasting further on, our prediction interval is quite wide, which is that shaded band. So you could see that we're predicting that at the end of this, our final size would be over 1.5 million, assuming that things continue the way they are. And on the curve on the right, you see the incidence or new cases daily, and the curve that's fitted to this. So you could see that currently we're experiencing just over 10,000 new cases per day. And at our peak, we would be experiencing close to 25,000 cases per day. And just to mention that this is diagnosed cases. The other thing that became quite clear is, I'm not sure if you don't know, South Africa has 9 provinces, and what became quite clear is that the burden per province was very different, and the COVID-19 trajectory in the provinces was quite different. So this shows you the plot of cumulative total cases over time for all the various provinces in South Africa, and you'll see that the province that experienced the most rapid growth and earliest was the Western Cape, and that's the curve you see first, the blue curve. And currently we're experiencing very rapid growth in Gauteng, which is predicted to overtake the Western Cape soon. So this is using data up to just 2 days ago. And the next province that's most affected is the Eastern Cape, followed by KwaZulu-Natal. And then we have our last 5 provinces, Limpopo, the Northwest, Mpumalanga, Northern Cape, and the Free State, which all have under 10,000 cases to date. So this curve really illustrates why it may be important to produce predictions at the provincial level rather than the national level. So I'm just showing you 2 of them here, and we've done them for all the provinces that we were looking at. So if we look at where do we think the Western Cape is going to be, based on our predictions and from our fitting, the Western Cape is likely to start turning soon and to start experiencing a slower rate of increase in new cases. Gauteng, on the other hand, is experiencing rapid growth, which you saw in the previous curve as well. And if things continue based on the data up to the 6th of July, we can expect that Gauteng by the mid-August period would have 125,000 cases. They're currently sitting on just below 75,000 cases. So we've shown that this modeling approach is quite robust and it provides precise estimates in the short term. One of the strengths is that you don't need to make any assumptions at all about the death rate or the infectious period, and you really modeling the data at hand and predicting what may happen based on what you have. This can also be a complication, though, and a possible weakness, because they're entirely dependent on the data at hand. So we can't make any statement about undiagnosed cases or unreported deaths. So everything we're producing and all these predictions are based on the diagnosed cases and the reported deaths. It also would be useful to zoom into an even finer level. So within each province, we've observed that the main cities or the metros are most affected by COVID-19. So we've also looked at whether we can do this kind of prediction at district level, which could be quite useful for resource allocation. It would also be very useful to forecast hospitalization and ICU admission rates in future. And we're just hoping we can get this data soon so that we can do this as well. And we're looking at the development of a user-friendly app to provide these real-time forecasts. And we're hoping that we'll be going live with this next week, which I will share with the team when this becomes available. This problem illustrated, tackling this modeling problem illustrated something quite clear in the beginning. And when we had seen that most of the models that were coming out of South Africa at the time, early on, were based on the SEIR type that I mentioned, that does involve several assumptions. So it became quite clear that people did not necessarily know that there are several approaches to modeling, and that you could do this growth curve modeling approach. And I think it could be quite beneficial, and we've all observed that it could be very beneficial in Africa to conduct training in infectious disease modeling, or even beyond that, like basically a COVID-19 toolkit. Ideally, we would want this kind of training to happen before, so that we're adequately prepared for the next COVID-19 outbreak, or the next wave, I mean, or any other outbreak. So it really emphasized the importance of training, and it was quite good that we had an existing collaboration with Hasselt University and with Ziv, and that he was part of this modeling group, because he provided quite crucial guidance as well to the team. So thank you very much for your attention. That is the end.
Thank you so much, Professor Reddy. Really interesting.
Yes.
I was wondering, the model that you're using here